Season podcast, and I am Ángela María Victoria-Castro from Yale University and Celia Pamela Corona-Villalobos from Johns Hopkins University. We are part of the NIH-funded Kidney Precision Medicine Project, or KPMP, that is designed to improve understanding of chronic kidney disease and acute kidney injury by performing Protocol Research Kidney Biopsies. The obtained kidney tissue is analyzed using advanced molecular imaging and data analytical methods to create the kidney tissue atlas. This is expected to ultimately facilitate the development of specific drug targets and enable individualized care for patients with kidney disease. Since the creation of this consortium, participants and patient stakeholders have been involved as equal partners with scientists and clinicians, guiding and contributing to the goals of the project with their unique perspectives and experiences. Particularly in the KPMP Community Engagement Committee, formed by the patient partners, researchers, and clinicians, we have developed a participant experience survey to be implemented 28 days after a research kidney biopsy. The survey aims to understand the perception of participants from the time they are approached by the research team to discuss the study, decide to join KPMP, continue through the informed consent process, and start the study procedures. We learned from 111 respondents that KPMP participants were motivated primarily by altruism, followed by an interest in gaining additional knowledge about their kidney disease. 99% of participants understood the informed consent process, and 97% reported that they understood their important role in the KPMP and that all of their questions were answered during the consent process. Findings reinforced our emphasis on presenting the benefits and risks of research in a way that promotes communication, volunteerism, and autonomy.
Participants also reported pain at a median level of 1 on a scale of 0 to 10 during and immediately after the biopsy procedure, and reported anxiety at a medium level of 3 during the research kidney biopsy and a medium level of 0 right after the procedure. We also learned that 12 participants experienced difficulty with parts of the study related to sample collection. After the detailed review of these survey findings, the Community Engagement Committee has recommended specific strategies, such as more convenient times for sample collection to decrease participant burden while maintaining the scientific integrity of the study, as well as the consideration of sedation for the biopsy procedure and the addition of comfort measures, such as playing music during the biopsy, to quell pain and anxiety in participants. Participants reported how being part of KPMP impacted their lives, as well as how they think and talk about their kidney disease. Even 50% mentioned that they will be willing to have another research biopsy for KPMP. The consortium is continuously recruiting new participants and actively building the Kidney Tissue Atlas, which is publicly available to the research community at atlas.kpmp.org. Our participant experience survey findings can provide guidelines to inform and enhance research participation involving kidney biopsies and patient-centered research practices. We would like to close by thanking the wonderful KPMP participants who made all this possible by bringing their valuable perspectives to the consortium, and a special thanks to the whole Community Engagement Committee, which continues ensuring that the viewpoints and priorities of patients are heard to improve and transform clinical research.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.